So I'm Hector Wells, I'm trained as an osteopath, and I was told that one of the reasons why you get a phantom pain is because there's a held pattern in the tissues which are damaged, which may be above the injury or in Kieran's state around the injury, but the old pattern is still present and therefore it can ignite pain. Now, one of the tissues which hold that pattern is bone tissue, and the technique I used on Kieran was to release bone tissue tension, which was a technique I was taught a number of years ago. But the interesting thing is it is an instant technique, it gives instant release and instant evidence of benefit in the session. Kieran's going to share with you his experience over a year ago. He had one treatment over a year ago of how that worked.
Hello, my name is Kieran Toner. I'm here with Hector Wells. It's the 27th of August 2019. About a year ago I came to Hector. I have chronic pain, phantom pain in the arm. You can probably tell this arm is paralysed. I had a very severe motorcycle crash about probably 30 years ago now. It's left me with what's called phantom pains in the arm. So the arm, I get shooting pains through the arm that they don't really have a cause. You could say they're imagined pains. Hector's been through his treatment with me. I've been very interested in that. He's explained it all through to me, and I've actually been through the treatment, and it's reduced the pain from really quite severe at times. And normally it feels a bit like it's been scalded, the arm, but at times the shooting pains, they're really intense. And Hector's treatment seemed to have cleared this up. So I'm very impressed. I'm back for another treatment now, so hopefully it'll be a continuing improvement. Thanks very much. If you'd like to talk to me or ask me about this or any time, you can talk to Hector and he'll pass my details on to you. Thanks very much.
How many treatments did you have, Kieran?
I've only had the one treatment so far, and I'm having the second one today.
A year later?
Yeah, a year later.
How effective was it the first time?
The first time was very, very effective, and amazingly it was effective right from the word go. There wasn't any, rest for a day, then it'll be improved. It worked immediately from the session. I was really very impressed with it.
What treatments have you tried?
I've tried various ones. I've tried the bone technique. I've tried a lot of acupuncture, various alternative therapies. This is the one that I've found that works very well.
You tried mirroring?
I've tried the mirror box treatment as well.
And your qualifications are?
I've a BSc in neuroscience. I'm trained in neuroscience, so I was a proper scientist.
Can you explain how the technique works?
Hector explains to me that it works through, it resets the magnetic poles in my body. I'm not very clear on what the technique is, but the outcome of it does seem to work.
So how many years you had the problem, Kieran?
Oh, it's probably 30 years.
And in 30 years is the best result?
Easily, yes.
You must have had normal treatment though.
I've had loads and loads of different treatments, a lot from the NHS, and they might work for half an hour or so. They're really not very good. The best therapy I've come up for it's sort of behavioural, so I avoid bashing the arm. I try and keep myself fit. I focus especially on my posture, things like that.
So you had loads of treatment, 30 years, that's a long time, isn't it?
Yeah, are we back on?
We've been on all the time.
Yeah. Okay, so I've had various bits and pieces done by the NHS that have proved it's just ineffective. It's worked a little bit, but not really any significant difference.
So there you have it. You've seen that phantom limb pain, which people haven't got a great deal of understanding of, appear to respond in a 30-year case history of excruciating pain. And Kieran, who's a neurologist, a neuroscientist, is baffled to how effective it works, and he'd used all his experience and training to find the best technique, and he actually found the technique of the bone release more effective than anything else. If you need to know more, or you know people who suffer from this condition, it appears that one treatment is sufficient to show the evidence that that person's responsive, and if they're a lot of pain, it's worth a go. Thank you for watching.